So common mistakes to avoid, and the scary part about talking about this means, of course, that I've made those mistakes. And that's reality, that no one's going to be perfect, everyone's eventually going to make mistakes. But here's some of my tips of things that I've come across and ideas to avoid them in the future. First of all, work in the correct environment. If you're working in a dark room with no magnification, bending over, uncomfortable, your surgical work will not be as good. If you've got the right environment to work in, you can do better skin cancer surgery. It's really simple, really useful. It takes some planning, but with the right environment, you will do better work. Using a hyfricator. So I feel very uncomfortable now to not have a hyfricator or a diathermy device available when I'm doing skin cancer surgery. Certainly when I started off, that wasn't always available, and my rates of complications with bleeding was much higher. So having the right tools to work with when performing skin cancer surgery is a very important thing. When you're planning surgery on the back, start your planning of the surgery with the patient sitting up. If you have the patient lying down and their head is resting on their hands, it changes the direction of tension on their back, and you suddenly don't get the right lines of closure. Reality is that people don't walk around with their hands in the air, they walk with their hands beside them. And that shows the natural lines of tension on the back. So start with them sitting up, draw out your lines of direction for closure of your ellipse on the back, and then lie them down in a comfortable position. Planning of the aftercare for your patients. It's no good doing a large procedure on someone's lower leg and then having them tell you, oh, by the way, doc, can I play golf tomorrow? It's really important to have that conversation with your patient well before the day of surgery and let them plan how they can rest up after surgery, especially when you're operating below the knee. Make it easy for your patients to access you if they have any concerns after surgery. So it's really important that you give them permission to come back. And if they've got concerns about whether the wound is infected or bleeding or whether the healing is happening the right way, they need to have access to you. Give them permission to do so. Otherwise, if the complication continues for longer, it's harder to fix. If they can get to you easily or get to somebody easily and they have permission to do so, the complications are dealt with earlier and they're easier to fix.